given out at the end of the conference today. So I would encourage you to please ask relevant questions. Excellence for promoting better patient experience. Nursing plays a crucial role in promoting better patient experience in healthcare settings. Nurses are on the front line of patient care, and their expertise in compassionate care are essential in ensuring the patients receive the highest quality care possible. Our panelists will provide valuable insight on the role of nursing in enhancing the quality of patient care and experience. For this discussion, I would like to invite with a big round of applause Ms. Bobby Ramesh, Director of Nursing at Continental Hospitals, Hyderabad. Capt. Dr. Usha Banerjee, Group Director of Nursing, Apollo Hospitals. Capt. Sandhya Shankar Pandey, Corporate Chief of Nursing, Fortis Healthcare Limited. Professor Dr. Rajesh Shah, Consultant Surgeon with Medico-legal expertise. Ms. Deepa, Chugh, Nursing Superintendent, Akash Healthcare Super Speciality Hospital. I would like Ms. Bobby to take over the session from here.
Team VOH, dear friends and all those seated in the audience, very good afternoon to all of you. It's indeed my privilege to be part of this panel discussion on nursing excellence to promote a better patient experience. While all organizations talk about various business strategies, marketing strategies, branding strategies, less is talked about nursing excellence and how nursing excellence help promote revenues or improve the patient satisfaction and patient experience. So here we are to discuss about the various aspects of nursing excellence and how nursing excellence help promote better patient experience, thereby promote the brand image of healthcare organizations. Nurses are the primary caregivers in any healthcare facility. They are the frontliners. They are there with the patient 24/7. Hence, they represent the very ethos of the institution they are part of. Thus, the quality and standard of nursing services is one of the fundamental aspects of defining, determining and promoting better patient experience. In the present scenario, where patients and their relatives, when their expectations are very high, their awareness levels are very high, it is imperative for any healthcare organization to improve the quality of the services, especially the nursing services, because nurses spend maximum time with the patients and to standardize the nursing care, thereby promoting nursing excellence and improving patient experience. I would like to welcome our first panelist, Capt. Dr. Usha Banerjee, Group Director of Nursing, Apollo Hospitals. My question to you, Capt. Dr. Usha Banerjee, what do you believe are the key factors that contribute to nursing excellence in improving patient experience?
Well, at the outset, I thank the VOH team for giving us this opportunity. Very glad to see a nursing representation at this prestigious podium here today. Healthcare has evolved immensely. We've come a long way. There's been an evolution of a revolution, and it's epic. Technology is taking center stage. There's brain drain. There is reforms, proliferating public-private partnership, growing media attention, litigation, huge amount of expectation from the consumers. Healthcare has become very, very complex, very volatile, very ambiguous, and very, very uncertain. And we recently witnessed what the pandemic brought to each one of us, where there was unpredictability and uncertainty. And I, representing the nursing fraternity of this country and my hospital group, I would say with immense pride that it was the nurses, yes, ladies and gentlemen, who were there right into the patient care areas where families and patients were left alone for care while the rest of them came in and went out. The patients were left to the care of the nurses, and it's the nurses who have worked tirelessly, silently, and put our country back on the map when things were torn apart. They were the ones who drove the vaccination program in this country, making it happen in hospitals and in places where people could not access. So that's the importance of nursing in the healthcare ecosystem. We all know that nurses are critical to patient care. They are critical to patient safety. They are critical to accreditations. They are critical to every doctor's practice. They are critical to the functioning of the organization. And they are the most critical to patient experience because they stand in between the organization and the patient 24/7. And managing with very young workforce, because the country today clocks the highest attrition ever. And there are multiple reasons, and probably we could have a panel for that exclusively. Why is it that our nurses leave? That's a whole big chapter. But ladies and gentlemen, each one of us sitting here as a citizen who would require healthcare need to understand the importance of nursing, who will deal with safety and experience. So when we talk about how can nursing excellence drive patient experience, I think the most important thing here is to ensure that nursing leadership, the governance, is positioned appropriately in the healthcare ecosystem. And we've witnessed hospitals where we have good governance from nursing leadership because of inclusion, uninhibited empowerment for decision making has driven patient care to whatever best we can. We were considering nurses to deliver patient care, but today a lot rides on their shoulder because we expect them to deliver patient experience. So for me, what I understand is the positioning of the nursing leadership in the entire nursing workforce, empowering them to understand where they can contribute towards patient experience, supporting them with key processes, consciously investing in technology that can enhance patient care. A lot less is done in this space. We have the big technology, we speak about artificial intelligence, big data, cloud computing. We can today provide care with mathematical accuracy and robotic care, but very less is given to the nurse to deliver that experience. And I'm sure when that's done, the patients will experience better care, and that for me, ladies and gentlemen, would be the differentiator. Otherwise, every single hospital is here to deliver patient care and clinical outcomes, but service outcomes, if we invest in the nursing workforce, we see that our patients will be more loyal, they will go back home happy, and there will be a lot of reimbursement and reputation that comes in for the organization.
Thank you, Capt. Dr. Usha Banerjee. You're absolutely right. The organizations need to invest in nursing and empower nursing so that they can render better patient services and improve the patient experience as well. My next question is to Captain Sandhya Shankar. In today's scenario, when it's a multifaceted and multidisciplinary care being extended to patients, why is nursing considered the key impactor on patient experience in the hospital?
I think
this would have been better suited while Usha was talking about it. But let me start with an example. When I buy a TV, I'm fascinated with the features of TV. I never go and check who has designed it, who has put the chips into it, or who has actually defined the HD screen, or so on and so forth. But I'm certainly appreciative about the features of the good TV which I'm using, and I'm very happy with its benefit. It's exactly the same in the hospitals when the patient is lying near the bed for treatment, is looking out for someone to take care of the ailments, to help him heal, to give him, the correct treatment, the correct procedures, and guide him, handle his queries. It's the people who respond to his needs are the one which make him feel special, which make him feel confident and safe in that intimidating environment. And friends, each one of you will agree, there's nobody else better than a doctor and a nurse, who is the face of the hospital which patient encounters most. Patient, while eating food, is not going to check who's the chef in the hospital kitchen. While covering himself with the bedsheet, is not going to check that which laundry services the hospital is availing. Patient is not going to ask which company from which this medicine or this tablet is being manufactured, isn't it? What is the brand of this cannula? Or what is the brand of the telephone which is lying next to me? While 74% of the healthcare, more than that, is delivered by the private sector, in the private healthcare sector in the country, we are more challenged, more concerned, and more focused on how our patients experience and feel in the hospital. And that's the time automatically the focus goes on the people, the caregivers who spend maximum time with the patients. Be it as a healer, advisor, communicator, teacher, or a friend. And that's how, Ms. Bobby, answer to your question is, nurse certainly is the only, I would say, golden capital, the only key factor when at the highest impactor as far as patient experience in the hospital is concerned. I'm not talking about the treatment. That will come again, it goes parallelly. But again, the treatment once get delivered to the patient is again, comes in the scope of the healing touch of the nurse, who makes the patient experience how the pain was managed, or how the medicine was administered, how the bed was tucked, or how he was assisted for his feeding needs or the elimination needs. So it's all about care in the sick state. So that's how, the nurses becomes the highest and the deepest key impactors in the hospital. So when you say that they are the highest key impactors, I would like to know, how do you measure the impact of nursing services on patient experience in your group of hospitals? Thank you very much, because sometimes somebody asks this question to me, I'm really very happy to answer, because something unique we have tried across the networks and started to work very well for us for more than 18 months now. We're looking forward to its digitization. But, gone are the days when a call center used to ask, or the patient experience person used to come and ask the patient, where will you rate your experience in a scale of 10 while during your stay in our hospital? Where will you rate the parking services, or the doctor's services, doctor's treatment, or the nursing services? Isn't it? It's high time we evolve. And certainly the good hospitals, the developed hospital, advanced techniques and the processes in the hospitals are evolving scientifically. It's now time to focus on our processes and start measuring those processes which touch the patient. How the patient's pain was managed, how the meal was served, how the medication was administered, and so on and so forth. But I would like to draw your attention on, if we want to measure on the patient experience, we as healthcare givers, the practitioners in the hospital, should focus on measuring the processes which touch the patients directly as well as indirectly, and that's the key. And of course, I don't deny that it's maybe manually doing it would be a when such solutions are literally rampantly developed in every nickel corner, including the practicing hospitals. Thank you, Captain Sandhya. It's how you make the patient feel during their course of stay in the hospital which matters the most. You rightly said that. My next question is to Ms. Deepa Chugh. How do you foster a culture of nursing excellence in your hospitals, and what are the challenges nurse leaders in our country face in promoting nursing excellence?
On the onset, let me thank VOH for providing us this opportunity, and thank you, ma'am, for this question. Now, there are two questions. One is to how are we going to foster nursing excellence at the bedside? Now, when it comes to bedside, it starts from how we have kept these processes. Then, very rightly, as Captain Sandhya just said, that how these processes were delivered. So these standardization of our processes has to initiate. I can very well say that all of us who are sitting over here, or the hospitals which are in the metropolitans, are keeping up these standards. They are knowing how to develop that. But what about the next level? Just cross the boundaries of Delhi. What is happening there? We don't have to look at the capital of India or only the 4 metropolitans sitting over here. We have to sweep down and understand, is there standardization in nursing? So first and foremost, I would say we should be having powerful associations, societies in nursing, which definitely has come up. We have various societies. We have ANI, we have ANS, which are coming up with a lot of standardization practices at the level of nursing practice at the bedside, so these nurses can give the best experience to the patient. And then second comes is your, how should we assess whether these practices are being delivered the right way? We are getting the nurses across the country from various cultures. Generation-wise differences are there. We have the present generation, the Generation Z, who have seen the COVID, and once they have come, they are a totally different set of people. Before that, the pre-COVID era, the kind of nurses which we were getting are completely different. We were having whatever we are having in the present time. The senior nurses, their mental structure, their culture is completely different. So we have to frame it in a way that it has to be delivered in the same exact way at the bedside. And that is why standardization in the processes across the country is very, very important. We have to sweep down every element of the healthcare. And that is how part of it to the mundane job which every individual in our healthcare or the nurses they perform. So that is one thing. So we have to start thinking that we have to trap the good or the best talent in this profession, and that can be done only when we make our youngsters in the school time only aware that nursing is the option for you and what best you can get in this profession. That is how recruitment now should be. Start diverting our recruitment into a different zone altogether.
Thank you, Ms. Deepa.
Thank you.
So what you rightly said about reward, recognition and retention of nurses is very much required in the present scenario wherein there is too much of shortage of nurses in our own country. Everybody, as soon as they finish their courses, are leaving for UK and Canada and Gulf countries too. They will come and there will be no nurses available in the country to take care of our patients. My next question is to Dr. Rajesh Shah. Dr. Shah, being a medical superintendent, do you agree with the statement that if we have a good culture of nursing excellence, then we have a better physician engagement and patient experience with physicians become better? Could you please elaborate on this?
Good afternoon. I say good afternoon to everybody. Because it's a very good food given by Navinji and VOH. So it's a dosing session and we have to get awakened. Friends, at first when I received a telephonic conversation with Navinji and he kept me in the session, I was little bit astonished why I am, because I was an odd man out. All the panelists were from the nursing profession. But second, my vision was, it is written here, idea, synergy and collaboration. And all these three words are put together is the nursing profession. They have every idea of helping the patient, and that's why with love, with emotions, we call them as a sister, as a brother. So this is an entirely different relationship of the patient with the nursing profession. So definitely a nursing profession is a noblest profession, and there is no doubt about it that without it nothing is possible. The first sentence I was taught in surgical classes that I suture it, thou heal it. Definitely as a surgeon, as a career of the surgeon, the work is suturing of the different parts of the body. But thou heal it. That at first time I was in an impression that thou is meaning for a God. But later on with the experience, I learned that thou is not only for a God. God is our own imaginations and our own respect. But the real gods are serving with us. If I am invited for some surgery demonstration, I would always prefer to take my nurse with me. The reason is only she is understanding my language without uttering a word, and she is helping me to give the best results. So naturally, nursing profession has a big role. Unfortunately, as far as our national data is concerned, we are supposed to have 3 nurses per 1,000 population, but we are having 1.7 nurses at present at 1,000 population. So we are nearly the half. So naturally the work burden is doubled. So that is the biggest problem. We are hearing so many problems against the nurses. Reason is behind this. Specifically I am working in the government, the public hospital, where every day we are facing the problems against some complaints against the nurses and all these things. I would quote one example. There one hospital, I was invited as a medico-legal expert who decided there was a poor patient in a Syrian operated in the same theatre, same doctor, and there was a loss of eye for all 4. We investigated the total matter and came to know that it is a infection, same organisms were found in all the 4 patients. They all lost the sight. after in detailed search, we came to know there was one new nurse which was appointed. And there is one gazette named as a 𝗓𝗏𝗧𝗘𝗥𝗡𝗙. If someone has visited the hospital, might be knowing. So that forceps was used for the instruments given to the doctors, and it was kept in such a solution which was infected and not changed, because she was she was not aware of the things, how to daily changes and all these things. In that circumstances, the things are happening. So as a nursing profession, is a very responsible role. Many incidences we have come across, and we have to face as a medico-legal expert also, that one sponge is left inside. Basically, if you see, as a surgeon, we always tell that right at the start of the operation, you count down the sponges taken on the operation table. And at the end, it is the nursing duty who should count down whether they are out or not. So this is another important space where nursing role is a very important role, and naturally at present, yesterday only, our 𝗕𝗏𝗧𝗘𝗥𝗡𝗙 has declared a very good thing, that this lacking of nursing care is going to be solved with the vision of our Prime Minister. They have decided to give each medical college in each district with one nursing institute affiliated with them, so that the number of nurses will definitely rise who are trained in the medical college nearby, and they will get the best results. Around 1500 crores of rupees has been allocated at present, and I think within near future it will give definitely a good role. So naturally, the experience of better healthcare is only possible with the best nursing care. Thank you, madam.
Thank you, Dr. Shah. You are absolutely right. If the nursing care is better, only then the clinicians' care would be better and the outcomes would improve. And the clinical outcomes would fully depend on the nursing care which is provided to the patients. My next question is to Ms. Deepa Chugh. How can nurses contribute to better patient experience during his or her stay in the hospital?
Can I answer the question? Sorry.
How can nurses contribute to better patient experiences during his or her stay in the hospital?
When it comes to patient experience, I remember one quote says, people at times when we do something, they may forget. If I say something, you may also forget. But you will never forget the way you were made to feel when you underwent any kind of experience. The feeling at that moment, and that feeling when you come to the hospital. No one is coming to the hospital willingly. It's for force or a negative area in your life. That is why you are coming to the hospital. And you are already coming with a negative note. And it becomes our responsibility as healthcare professionals to convert it into a positive side, which is a task by itself. And ladies and gentlemen, let me just pat all of our backs, or I would say on behalf of the nurses, we pat our back that we are able to deliver that best and the best experience a patient can get it in the hospital. Now, how to make it better than what we do it in our hospitals are basically few things which I would like to say is patient-centric nursing strategies. When I say patient-centric nursing strategies are getting the right patient to the right nurse at the right time. Now, there are many scientific mechanisms in today's time which are available, where we can measure which patient requires which kind of nurse as per the skill of the nurse. And the second element is the element of art, that is through experience the senior nurses gain and they are able to deliver. And that is how we have the hierarchical level in nursing. The second point would be empowering your patient. Today's time, patient is the advocate for himself. So empower your patient. Make them decide what they level or the nursing level, then time is gone that they would be having that feel-good factor. Engaging the family, because we are not going to only deliver the care. The nursing care is not bound today only in the four walls of the hospital. We have to go a step ahead in the community, at their home. So how would these patients be treated at home is very important. We are giving the best at the hospital, but they have to be delivered the same accuracy at the home front and in the community. So we'll have to involve the patient-related, significant others and the community for better patient care. And last but not the least, I would say, designing happy nurses. Now when I say happy nurses, they are physically fit and high on EQ and IQ. Now that is the point where we all nurse leaders are struggling, and we are striving to make a talented group of nurses to give you the best experience when you enter the hospital with a smiling face. And if you go with that smiling face, would be the reward which every nurse gets, and no other recognition the nurse is asking you.
Thank you, Ms. Deepa. Rightly said, it is not what you did that matters, it is, how you make them feel that matters, especially when it comes to nursing care. Captain Dr. Usha Banerjee, you would want to add something else onto this?
Well, ladies and gentlemen, if you look at it from my lens of having been a bedside nurse to a nurse administrator, managing a big conglomerate, a group of hospitals, I would say with unflinching words that we nurses are a gift of God. Nurses do things which no family member can do, trust me. You have a patient who is at the bedside, ailing, going through an emotional roller coaster. It's the nurse who handles it, however young or old she is. Nurses have this beautiful gift of celebrating the miracle of birth, seeing a child being born. As I say, I have a goose flesh talking to you. It's a beautiful feeling, and I don't think many of them seated here or outside can feel that. They stand in with dignity when somebody is dying, silently saying a prayer that this person leaves this world in the best possible way, in the most dignified way. To pack a dead body calls for something, for a very, very young person. Someone to whom we have to break bad news that you have just been diagnosed to have cancer, or your leg is going to be amputated, or you're suffering from a major illness, or that your life would be restricted to a bed or to some limitations. It's the nurse who provides unconditional emotional support, which I don't think anyone can. That in itself is the biggest experience which the nurse can deliver, and I'm glad that it is the ethos, the very fundamental, the very fabric of the nursing profession. So, for all of you seated here, the shortage of nurses we see in this country, tomorrow I fear how would nursing care be delivered when each one of us would require it. So promote the wonderful things which nurses do wherever you can, supporting the patients, supporting the doctors, supporting the entire healthcare ecosystem, whether it is in the hospital, at homes, in schools, or probably tomorrow when you launch off to space, you might have a nurse in that spacecraft. Thank you.
Thank you, Dr. Usha Banerjee. I also would want you to elaborate on how enhancing patient experience through nursing excellence will improve the revenue in hospitals. I'm sure the healthcare administrators sitting over there may be thinking nursing as a cost center. those MBA in hospital admin students, they would not have been taught that nurses have to be included for business review, and nurses do contribute to the revenue in the hospitals. So I would request you to highlight on how nursing excellence improve the revenue in hospitals.
Well, that's a great question. I work with the Apollo Group of Hospitals, which is the first corporate hospital for business for profit. And I'm glad that I sit in the management role which looks at profit margins and EBITDA, because the organization believes that nursing can bring in a lot of reimbursement to the organization. There's a lot that nurses handle, a lot of capital. There are a lot of assets. If you really don't sweat them, they lie idle. You don't make money. One wrong experience to a patient, 10 patients lost. You don't need marketing. You need good experience to bring back patients into the organization. A lot of billing inputs are done by the nurses. You might have great experience through the state, but what if the bills went wrong? Preparing a patient up for surgery and getting the right patient in there and ensuring that the right experience is given to the patient and the patient does not have a complication which increases his average length of stay is money to the organization. Every negligence that happens and there's a discounted bill, it's loss of money. So for me, ladies and gentlemen, a nurse touches every facet of the organization, every single department, every single process, and the organization at large. So for me, nurses are the most vital for building money in the company.
Thank you, Captain Dr. Usha Banerjee. As we are running short of time, I would request the other panelists to restrict your answers to 4 minutes each. So my next question is to Dr. Rajesh Shah. As a medico-legal expert, what are the major concerns you have come across during the patient stay in hospitals, especially with regard to nursing? How to prevent such issues to enable a better patient experience?
As I mentioned earlier also, there are many medical negligence cases are coming up. And if we go into the details of the things, many times nursing professionals are also at some or the other fault. And specifically, I have more experience with the government hospital. I had seen many times nurses knitting the sweater and not attending the patient's complaint. He is preparing the vegetables to take the home and not attending the complaints of a relative of a patient. So these are the so many incidences we come across. It is the right education and right formation of the nursing professional is very much required in the country. And if it is given in a proper shape, then definitely there will be an excellent patient experience in the healthcare industry. Consent of the patient is a very much required and valued things. Many times, as rightly mentioned, that expression of whatever bad result is also is to be done. So it should be properly done. Many times what happens, the information is not to be passed. The confidentiality has to be kept, are spreaded at the time of by nursing staffs. Many times the postmortem has to be done. Many times you have to explain as a nurse to the patient, see so many things which is not a good taste of the patient. In spite of that, one has to do. In the morning also, Neeraj has mentioned the role of the nursing. He is a food and beverage manager also. She is a transport manager also. She is a laundry manager also. So many works. She is an IT manager also. That TV is not working, the complaint will come to the nurse. So it was rightly mentioned that so many facets they have to look after. But if the work is done with the fullest of the heart and love and emotions, as the patient are calling them as a brother and sister, I think they will not have to enter into any law problems.
Thank you, Dr. Shah. As you rightly said, nurses are all-rounders, be it from attending to the call bell, even attending to various medical emergencies. They are there doing everybody's job, and that brings in a huge level of stress and responsibilities on the nurses. Over to you, Captain Sandhya. Do you feel that nurses have to be more empowered and valued in our hospitals so that they can enhance the patient experience?
Thank
Thank you, Ms. Bobby. Empowered and valued. I think they two are completely different zones. When I say valued, certainly yes, especially more than 70% of the hospitals, the moment the infra starts to raise, the human resource and the hospital management start tapping the entire area, zones, states, regions on getting the nurses for the hospital to run the hospital. They believe that the hospital has to run and they have to run with the nurses. But is it valuing? No, probably it's the need. And it's very often mistaken as that we value nurses and that's the reason we have them here. No. Valuing is something, what Capt. said a few minutes back while sitting in the boardroom. It's from leadership at the bedside to the leadership in the boardrooms. Do we really need a nurse to formulate my policies, to formulate my SOPs, to decide the line of treatment of my patient, to know the critical alerts from the nurse if she has something else to say, that yes, the sugars are high because the insulin was not titrated properly, so on and so forth. So do we really need? Is this sensitivity there in the hospital, in the treating doctor or not? Is this sensitivity there in the management of the hospital, in the administrators, both the nursing and the medical administrators of the hospital or not? That's how the value of the nurses come in. So it's quite subjective. I can't sum it up in a sentence whether they are valued or not. It's not an objective response. But it actually applies and implies both to the hospitals in the country, whether the profession is valued or not. And empowerment is probably it's getting abused these days. It's not something which is donated and given by the management. I feel nurses themselves are responsible whether they earn their empowerment or not. It's completely an individual phenomenon whether a particular nurse is dependable for the patient. Is she dependable for the doctor? Is she dependable by her entire team? Reliable by the others for running the processes, carrying out the treatment or managing the entire team? And the people who do it effectively and efficiently automatically are looked upon. And that's how it's that situation, that earned situation is called as empowerment when they become the decision maker eventually. So empowerment is something which is earned. It's easy to say when we talk about the structured healthcare organizations which run in the country, but more importantly, what about the healthcare sector, the hospitals across the country? And over there probably it is very much required. When we talk of empowerment, it has to be driven through the policies in the SOPs, whether a nursing head of the hospital is allowed to make policies unanimously what works well for the nurses. Now those are the things which we say empowering them to make decisions. So working as enablers in the administration and the management will help the nurses be more empowered, those who need it. Everybody is not a type A personality who would actually earn by roaring it. So these are the things when the management has to be an enabler or a nurses equipping themselves with the right information and knowledge to earn their the rights, their responsibilities and their positioning in the healthcare team.
Thank you so much, Captain Sandhya. We are running short of time, 2 minutes left, 2.5 minutes precisely. A quick take-home message for the audience, Captain Dr. Usha Banerjee.
I think the entire country, I've already said it and I would reinforce that. The country today faces an acute shortage of nurses and I think it's important for us to value the contribution of nurses because it's the nurse who brings in the reputation and reimbursement for the ecosystem.
Thank you, Captain Dr. Usha Banerjee. Next, I'd like to ask Ms. Deepa to share.
I would say if it is a take-home message for all, then invest in your nurses and reap the rewards.
Thank you, Dr. Shah.
already given a message. If patient calls you brother and sister, be the brother and sister in real sense. There will not be anything against the nursing.
Thank you. Lastly, Captain Sandhya.
Thank you, ma'am. And to sum it strong, 2 messages. One is for the community out of the hospitals. When you see a nurse in the hospital, a young girl, 22, 23-year-old, as equal to any other youngster in the country. But she's probably, remember always, she had that 10-armed Durga, he or she, who's actually a multitasker for everybody handling every need of the patients. Respect. Only one word which applies to this human being is respect. So let's pledge to respect nurses and regard them for whatever they do. And to the administrators, allow and enable the nurses for practicing their profession, and that's how the patient experience, the excellence, the revenue, the business flourishes.
Thank you, Captain Sandhya. Well, that was a spirit exchange of ideas and some very thought-provoking views shared by the esteemed members on the panel. In conclusion, there's no doubt that promoting a culture of nursing excellence is a fundamental step to promote patient experience. I'd like to share with you all 4 E's of nursing excellence. Educate nurses with continuous learning goals to improve knowledge and skills. Equip nurses with the latest technologies, clinical protocols and soft skills required. Entrust nurses with responsibilities and refrain from micromanagement, and empower nurses to take patient care related decisions. And I am sure that whatever we have discussed today, if an organization implements all these, not only we will be able to promote patient experience, but also improve patient outcomes, improve patient reviews and feedbacks, and also improve revenues, thereby promoting the brand image of the healthcare organization. Thank you all so much. Thank you, esteemed panelists, for all your messages and all your thought-provoking views, and the audience for your patient listening. And lastly, I would like to thank Dr. Naveen, Michelle, Pinky and the team of Voice of Healthcare for including a nursing session in all their conclaves every year. It is a need of the hour, definitely, because there's no much of importance is given to nursing in all these healthcare conclaves. Only if you give platforms like this will people come to know what nurses do exactly in terms of not only giving injections or medications to the patient, but also improving the patient satisfaction experiences and also improving the revenue of the hospitals. Thank you all so very much. Yeah. If you have any question you all can ask. Exactly, time is up, I think, now. Audience, any questions?
We have one question.
See, let me begin by thanking all the nurses. As a junior doctor, we all learn. As a junior doctors, we all learn from the senior nurses every time. The medical superintendent, they are the diffuser when we fight. So I appreciate the nursing profession. But what is lacking in India is the professionalism, like teaching, policing, nursing should be upgraded. Because IIT is offering B.Ed now, so the government is. So what we want is the nurses to become a real manager, nurses doing MBA, nurses doing law, nurses doing public health. Only those things can lift you up so that you can bring the younger than now that fact that the diploma is being gradually abolished, the gap between the medical doctor and the diploma holders is wide. Now the degree holders can be really assertive, but kindly do justice for your A&M. They are the poorest of the poor in the hospital. Encourage them to do sociology, psychology. See, these people don't know anything. People, misguide them and make them as nurses. Only after A&M they know the specialty and nurses, so they will also be contributing to our healthcare. Ultimately, Indian nurses should be everywhere. That is what is our wish. Thank you. All the best.
Thank you so much. Indian nurses are there everywhere and we are proud of that as well. Yeah.
Please stand on your shoulders.
So, may I?
Anyone else? One
Yes.
more?
Yeah. So,
Yeah.
so to all the esteemed panelists, from the nursing excellence point of view, what is your perspective when you think that a nurse, which is actually, we as an organization also believe, they are the people who spends the longest time with the patient in a direct contact. When you say direct contact, may it be clinical, psychological, physical, whatever it is, contact hours spent by them is the highest. What are your prospective or thinking outcome when we think that allied service such as dinner management, such as food management, F&B should not be a part of nursing excellence and should be outsourced?
So, when we say that the F&B and other services, definitely different verticals take care. Nurses mostly look into nursing activities across most of the hospitals and some non-nursing activity. It is always preferable that non-nursing activities are diverted to the respective personnel so that nurses can spend more time at the bedside and look into more into patient care services. Yeah. You would like to add on something?
Can I add?
Yeah.
So, answer to your question is, first, the nursing curriculum when it was envisioned and designed did not include anything of 70% of the tasks which the nurses are made to do in the hospitals today.
Fully agree with you, ma'am.
And we do call them non-value adding activities.
Absolutely.
Now, we need to be thoughtful on developing this skills in other, when you said allied health professionals, in other skills in other personnels, and say something really innovative which has worked very well for in our organization. We call them nurse-led patient care teams.
Yes.
Nurse-led patient care teams has got multi-skilled people with defined job roles within the regulatory safe and scope, touching the patients and perform. Everybody does their job in the benefit and interest and safety of the patients and the organization. So this is one of the things. But it's high time. Coming back to my first point, it's high time we eliminate these non-value-adding tasks and let the nurses care, heal, and treat the patients.
Absolutely.
Because India has to realize this. With Dr. Shah's point, in this acute shortage, probably this is the only solution.
I fully agree, ma'am. That's the another reason that though ANI is now formed and it's functioning also, and 27th of May we are witnessing at Hyderabad AIG. I know we are part of that.
But already we have a Trained Nurses Association of India since many years. Even when we were students, there's a Trained Nurses Association, so there are many such associations.
I agree with that, but the sorry part of it, probably you all will agree. The nursing say or the nursing association, when we look to a word form, say for example Japanese Nursing Association, Asian Nursing Association, why Indian Nursing Association is still not part of those associations or empanelment with those associations?
So now many associations have come up and they all are, like Deepa was mentioning about ANI, TNAI, and many such associations are there, in Telangana. Many states all have their state nursing association, and centrally also many associations have been formed.
Pace and calibrate our speed, which we will. But unfortunately, we need a bigger lobby. We need doctors to lobby for nursing. We need industry partners. We as nurses should own up. So there's a lot of work in progress. So you will see us like the Asian, like the Canadian, American. You will see us there. Today we are slowly becoming benchmarks for the world. Yeah.
No question mark on that.
Thank you. One last
one. Love to be associated with that. Thank you.
Thank you. One last question is.
It was a great session. Very important. Am I audible?
Use more louder, please.
Am I audible now?
Yes.
Yeah, it was a great session. Very important. I have a very small question. We have talked about what to do for patients, what we are doing for patient healthcare, AI technology. I am from AI background. So AI technology and medicine and doctors and everything. Now when we are coming to this nursing section, then we have talked about what all duties nurses do. But I think that very crucially we are missing one point. That what about the well-being of nurses? Because they are round the clock working. And what I think the gender ratio female versus male is more, or female is more. Okay, and we know that female have a lot chaotic household chores to take care, and then after leaving that, they're coming to hospital where they are care of the patients, they are getting mentally challenged, physically challenged, not getting time to sleep, and many countless, things we have not mentioned and we have not noticed. Now, when we are saying nurses are the ones which are taking care, my question is, what approach are we taking to take care of nurses and for their well-being?
Well, thank you for the question. The panel was on patient experience, so we kind of kept it to that. Interestingly, a lot is being spoken in this space, and we as leaders believe that caring for the caregivers is important. Unless they are cared for, they're not going to care for people. So organizations today, mandatorily, it's part of our accreditation process, regulatory process. The leadership that we bring into our hospitals do take care of the nurses in many which ways. We understand, especially in high-end specialties, so emotional quotient, coping with anxiety, mental health, physical health. We do a lot of yoga, recreation, fun at work. So that is definitely there in many hospitals today. And it's an open door policy. The younger generation have far more needs than we were when we were young. So it's there today.
Then it's a great thing.
Lots of things are happening in private hospitals, but a lot more to be done in government hospitals for the welfare of nurses. So definitely that is also very much important for the well-being of nurses. Take care of them so that they can take care of the patient to promote better patient experience. Thank you all once again for your active participation. Thank you so much, Dr. 𝗕𝗓𝗓𝗓, for giving this platform, and hope to have more such sessions in future. And I'd like to give a special thanks to Pinky, Ritika, and the other members of VOH for roping in three of us, the alumni. We are the alumni of College of Nursing, Armed Forces Medical College, which is the most prestigious college in the country. So for the first time, myself, Captain Usha and Captain Sandhya have come together. Thank you so much for roping us in. And Deepa also is a fellow NABH assessor, so thanks a lot. And Dr. Rajesh sir, thanks so much. In all the ladies only panel, you're there. Last time also you were there with us as a medical superintendent to contribute. Thank you so much. Thanks a lot, everyone.
Thank you so much, Ms. Bobby, for moderating this session for us. Can we have a big round of applause for this inspiring session that we had just now? Now, I would like to take this opportunity to felicitate all the dignitaries present with us for the session. I would like Ms. Bobby to felicitate the co-panelists. Can we have the... Can we have the Captain Dr. Usha Banerjee.
Rahul.
Captain Sandhya Shankar Pandey.
Rahul.
Professor Dr. Rajesh C. Shah. Ms. Deepa Chugh.
Rahul.
Now I would like to call upon stage Dr. 𝗕𝗓𝗓𝗓 to felicitate Ms. Bobby Ramesh. I request the dignitaries to please stay with us for a group picture.